Mayo Clinic is a healthcare organization focused on patient care excellence, research, and education.
60,000 people come to work here with a common purpose, and that is to meet the needs of the patient. Mayo Clinic is really a model of what healthcare could be.
In the world of trying to be more efficient and providing the best care, the iPhone and the iPad have definitely given us a vision of where we can go in the future.
Mayo Clinic is a not-for-profit humanitarian healthcare organization that has built up over nearly 150 years. We had the development of the heart-lung machine, the first total hip replacement, the first place to have a CAT scanner on site, innovation, technology, science and medicine working together. Doctors, nurses, other care providers are very mobile, but we still need access to organize information to help patients get better care.
When we changed to an electronic medical record, it was very problematic. The information was coming from multiple different sources, and it required logging on to multiple different applications within a computer. Physicians felt like they were interacting with computers more than they were interacting with patients. Mayo Clinic developed an application in-house called Synthesis Mobile, which synthesizes patient data from innumerable different sources and makes it readily available on iPhone or iPad. Imaging, laboratory studies, medications, really any data that we collect on a patient is available on Synthesis Mobile. Now I can sit with a patient, have an eye-to-eye conversation and show them their CAT scan or a video about what the options are. I can use Synthesis to change an IV setting for a patient in the hospital, and I can charge capture or do order entry from within the application. There's no question that I'm faster in taking care of patients, and there's never a time that you're away from critical information.
We also developed a Mayo Clinic patient app. If you're a Mayo Clinic patient, you can log in with a secure encrypted password and have access anywhere in the world to your medical record. It also provides secure messaging, and we can now provide monitoring capabilities to patients in the home. And Mayo Clinic has a vision of having a meaningful relationship with over 200 million patients. The iPhone and the iPad are going to help us get there.
This technology is enabling communication. We're now able to see doctors and nurses and patients in real time sharing information that literally just became available to them minutes before.
Our number one concern is the security of our patient's medical record and content. iOS provided the security we were looking for, and the ability to write applications that leave no trace or data on that device that we would consider confidential. We have iOS devices all over Mayo Clinic, from nurses to helicopter pilots to ambulance drivers to physicians meeting with patients. It makes everybody more efficient. The iPhone and the iPad bring to us a level of technology that didn't exist in the past.
It really brings us back to when healthcare was a personal interaction between the physician and the patient.
The question is, how do we stay connected with people? How are we there for them when they need us? With this technology, we can be more accurate and more complete, which means better outcomes, safer care, and that, I think, is really quite extraordinary. This is a very exciting time to be in medicine.